So I got my official EDS, Ehlers-Danlos diagnosis today, and I've always suspected I had it because as patients were rolling in and they had similar symptoms as mine, grilled dinner, cereal, but it has fiber in it, fiber cereal. So it was hard to get the diagnosis. I found somebody through the Ehlers-Danlos website. Since I took an advocacy month, it was like, I think 4 months long program through them where they had weekly meetings introducing different clinical professionals and also people that have EDS and like what to look for, how the process goes when you're looking for somebody that has the clinical knowledge and experience to one, diagnose you, but two, have referrals for your care team. So that was very helpful because now I will be seeing a cardiologist who is EDS informed because I'm having some heart issues, and then I will also be seeing an immunologist, an allergist, because I'm having skin issues. My doctor thinks and suspects I have POTS and MCAS, or mast cell activation syndrome, which is a common comorbidity under the Ehlers-Danlos umbrella. Where it impacts my clients, or my clients that potentially may have an EDS diagnosis, because it is considered rare, but I would say it's more rarely diagnosed because the information was not there. For example, the physician who I saw today had a student with him. When we were talking using acronyms that are familiar for those who have EDS, the student had no idea what we were talking about. We had to stop often to explain the acronyms. What's the Baton scale? What's the criterion for an adult? There's so many different umbrellas under the EDS. Hypermobile or the classic EDS, where you just think you're a bendy person. I'm not super bendy. I would say I'm more bendy than most. I'm not super bendy. My skin elasticity is there and I have soft skin, but really my quality of life has gone downhill. So, I would say the most devastating impact I had was my jaw pain and joint pain. Since I've gone through my own myofunctional therapy journey years ago, that was the one thing that I don't have symptoms. If I do, they're very rare, but I can always relate it to hormone. I have tools to get me out of a relapse or a flare. With the myofunctional component, what's really important with patients with EDS is that they have supportive therapists that can help in their department of expertise. So I would say our department is orofacial, myology, joint pain, swallowing. Always would choke on my pills. Our throats are a little tighter. The swallowing muscles are a little tighter. Things don't go down as easily. Motility is impacted. And getting somebody with EDS functionally stable from the neck up with those specific muscles, I think, is a big, huge department in orofacial myology that hasn't been discussed that often, but I have seen just from evidence-based practice with my own patients and myself. So always suspected I had it, but I got a formal diagnosis today. That was pretty cool. Not happy, but because it's something you have to deal with the rest of your life, but it validates a lot of, I don't want to get emotional, but it validates a lot of things for me.